All right, we'll get started here. Make sure everyone gets on. All right, hello everyone. Thank you for joining us. My name is Malaya Florendo, and I'm the trainer with RX Safe Del Norte. And I want to welcome everyone to the workshop with HACHR today, Harm Reduction 101. I do want to remind everyone that we are Facebook Live and we are recording, just to keep that in mind. And yeah, we'll start at 2 o'clock today and go to 3:30. So I want to give a chance for folks with HACHR to introduce themselves.
Hi, my name is Jessica Smith. I am the current executive director. We have some transitions coming up, so I will be moving out of that position very soon, and I'll still be with the board of directors, so participating in that way. And I'll go ahead and let Lasara introduce themselves.
I'm Lasara Firefox Allen, and I am one of the co-directors incoming with Will Gibson, who will be here in a little bit. We are excited to be coming into this position and following in Jessica's brilliant footsteps. And I'm excited to be presenting with Jessica today.
Awesome. Thank you so much. And we're just so happy to have you all today. And yeah, I'm really excited for Harm Reduction 101. So again, thank you, Jessica and Lasara, for joining us today. And yeah, this is HACHR. Harm reduction is both a practical set of strategies to address the potential harms of substance use, as well as a movement for social justice. It centers the voices and experiences of people who use drugs, PWUD, and recognize them and practices of harm reduction, or recognizes them as experts in their own lives. This presentation will highlight the core principles and practices of harm reduction, provide tools for stigma reduction, and briefly discuss HACHR's work in the community. So again, we're really grateful for HACHR to be here today to share some of what they are doing right now, especially revolving around harm reduction. Before we get started, I do want to acknowledge the group agreements we have for the summit. They're pretty general. We're going to have them for every presentation, but yeah, I want to go over a few of them just to keep in mind that respect and kindness are key. Remember, if you're not being respectful and it becomes an issue, we will have to kick you off and remove you from the discussion today. Remember, show tolerance and sensitivity for differences. Everyone is different and may have different views. Participants in the group come from different cultural, racial, gender, and sexually oriented backgrounds, so please be aware and sensitive to judgmental comments. Please try and use positive language and stay away from using racial, homophobic, or degrading remarks. And this is a safe space, and it is free of judgment. So it's all right to disagree with someone else's point of views, but please don't put each other down for it. And it's a space where participants should feel comfortable. So feel free to share your thoughts and ideas without any worry of punishment or judgments. We do want to remind you also for sharing stories. If it isn't your story, please don't use names and respect other people's stories. If the participants are sharing personal information, again, leave out names. And it just helps with spreading the rumors and detracts from the point of information trying to be communicated. Also, if you need to, please ask for clarification. If you don't understand, don't be afraid to ask if you're participating in the questions. We will have questions in the chat. We are Facebook Live, so we will have questions in the Facebook Live chat. So we will have someone monitoring. We do want to remind everyone again, for Facebook Live, it is about a 45-second delay. So if you post on there, it may take us a minute to see it and respond. So again, these are group agreements, and we just ask you to please be respectful and yeah, mind other people and standard Zoom courtesy rules. So we also want to make sure people are aware that some of the stuff we'll be talking about may, bring up some feelings. It may bring up some trauma for some people. And so we want to offer the numbers if you need to reach out to someone for the mental health in Del Norte, as well as the 24-hour crisis services that are available. And just remember, if you are feeling this way and you do need to reach out to someone, these are some professionals who can maybe be much better for you to reach out to than we could. So just please try and remember some of the stuff we might be bringing up may be somewhat sensitive. And as far as informed consent and privacy, remember each person's participation in this presentation is voluntary. Please respect the privacy of others and do not share personal information with anyone else. This training is being recorded and it may be live on social media. If you're participating via Zoom, please turn your video camera off and stay muted. All right. And lastly, we just really want to acknowledge the land that we're meeting up on today. The indigenous peoples of this area, the Tallawah-Dini, Yurok, Karuk, Hupa, Wiyot, and there are many rancherias in this area, such as Elk River, Rezagini, Big Lagoon, Trinidad, Blue Lake, Table Bluff, and Ronerville. And yeah, we just want to acknowledge the land that we're on today, and we encourage you to all viewing to acknowledge the land that you're on with us. So the indigenous peoples who lived together and cared for this land and each other since time immemorial. We honor with gratitude the land itself and the people who have been the stewards of this land for generations. We know the effects of colonization have impacted indigenous people disproportionately, and we hope that through this series we can learn together to help heal and work towards a healthy future. So thank you. And oops. Now I will pass it over to HACHR.
Great. Let's see, I will share the screen. We have a PowerPoint for y'all. Okay. All right. So we are from HACHR, the Humboldt Area Center for Harm Reduction. I'm Jessica, Lasara is with us right now, and Will, who is going to be another one of our incoming co-directors, will be joining us here in a little while. He's downstairs making sure that our drop-in today is cleaned up and finished. We do have services today, so we appreciate him taking that on and finishing up while we get this started. You can see our contact information there below. If you have further questions or want more details, you can email us or you can visit our website. You can also find us on Facebook. Lots of information everywhere if you've got some more questions that we might not be able to answer today. So here's a quick overview. We'll chat with you a little bit about who HACHR is, what we do in the community. Obviously, y'all are here for Harm Reduction 101, so we'll talk about what harm reduction is. Lasara is going to spend some time chatting about harm reduction as a philosophy, and especially in relation to COVID-19 times. And then we'll have some time at the end for questions and answers. We're also open to having questions as they come up, so please use your chat box, or if you're watching from Facebook Live, type some stuff in there. And we'll have our moderators keep an eye on that, and we can answer things as we go if you've got some burning questions. All right, so a little bit about HACHR. We are a 501c3 nonprofit. We do drop-in services and outreach. Both of those things still remain even during COVID-19. We have some very specific protocols in place to maintain the safety of our staff and the folks that we serve. So for our drop-in center, people haven't been able to come inside. We do everything sort of from the foyer, the front of our building, with our front door open. But we've still been able to provide most of our services. And then outreach has always sort of been an open air situation. So we're able to practice proper social distancing that way, use masks, all of those protocols that are helping to keep folks safe. We also have a board of directors. right now, I have been acting as the executive director for the past year, and we're about to have 2 co-directors, which is going to be very exciting for HACHR. It really aligns with our values as far as breaking down hierarchies and just really sort of spreading out the workload. And we also currently have 2 part-time hourly staff, and then we have 3 peer leaders who receive stipend positions, and we'll talk a little bit more about that. But HACHR and harm reduction as a whole is really about centering people who use drugs, and so we make sure that we include folks who use drugs in all parts of our program and hire them as much as we can. And we also have student and community volunteers. COVID kind of squashed our student volunteers this past semester, and I'm not sure how that's going to look moving forward, but we're hopeful to be able to engage with them again soon. We did have some students from the psych department at HSU do some sort of distance learning stuff. They took some kits home and made those from home. They also were able to do some data entry from home. So we're going to have to continue to get creative with our volunteer force. And so over here is a little bit of a history of HACHR. Outreach started in 2015 and even earlier. Brandy Wilson was our founder and the first executive director. She's now gone on to be the ED at Chicago Recovery Alliance, which is a very big program, well-respected and well-known program in Chicago. We're very proud of her. And this was her brainchild. So as it progressed, Exchange became official in 2016, and then we added extra support services really starting in 2018. So right now, we have syringe exchange, we have overdose prevention, which includes a distribution of naloxone or Narcan, as well as fentanyl test strips. We provide food, we provide clothing, we have a foot care clinic. A lot of the folks that we see are unhoused, so foot health is super vital to them. So they can come in and soak their feet in a hot Epsom salt bath. We haven't been able to do that currently because of COVID, but that's something we're hoping to be able to do soon. We have a little free pantry out front provided by Cooperation Humboldt. So even when we're not open, folks can still access that. And obviously during COVID, we've been a touch point for masks, hand sanitizer, just general hygiene supplies, wound care supplies, everything. We really do try to address the whole person and make sure that we're providing as much as we can. And then we do a lot of referrals out to other services if we don't have something that person needs. And I'll talk about our other services real quick too. So as you can see, we're one of 5 HIV and Hep C testing entities in our county. So that has been on hold because of COVID. With Lasara coming in, that was their position before getting this co-director position. So they were really sort of coordinating the testing program, and they're excited to get that started again outside in sort of like a easy up thing so we can have privacy and openness to again make it safer while working during COVID. We also recently started a partnership with Bright Heart Health. They provide Suboxone via telehealth, and they're piloting a very low barrier program specifically for syringe exchange programs and their participants. In the last about 3 to 4 weeks, we've successfully connected 15 people with Suboxone. So it already has really been a game changer for a lot of folks who've been trying to get into recovery, and being able to access this over the computer, get a prescription the same day, just check in with a doctor weekly, really is exciting for folks, and they're seeking the care that they've been trying to access for such a long time. And so all of the stuff that we do is informed by data, research, and best practices. HACHR itself was born out of personal loss, folks seeing unnecessary loss of life and wanting to do something about it. And we are peer-led, which I mentioned before. It includes folks with lived experience, not only in substance use, but in homelessness, in sex work, in incarceration. All of those folks are the experts. They help design and determine the programs and the policies. So we really want them to be involved in all aspects of our program. Does anyone have any questions about that? That was kind of a lot thrown out to you.
I've been keeping an eye on that, Jessica. Somebody had a question about slides, and I told them that if they email us, that I will provide a link to the slides to them. So that was it.
Perfect. Yeah, we can do it in PDF form as well. Certainly. Yeah.
And the video will be up on YouTube and Facebook after this too, so people can always take a look then too.
Great. So here's just sort of a broader overview of who we are and what we believe in. We are committed to building stronger, healthier communities by co-creating spaces that foster dignity, equity, and choice. We really are focused on improving the overall health and wellness of the folks that we serve and the community at large. We understand that Humboldt County is disproportionately impacted by substance use, Hep C, homelessness, suicide, mental health issues, all of those things. You know, we have sometimes limited resources and capacity in our rural community. So we really want to try to address all of those things that with the services that we provide. And also with the advocacy that we do. We do a lot of sort of statewide advocacy, pushing for more money for things like mental health, for Hep C, HIV, and STI testing, for harm reduction programs and supplies. So we're not just doing the direct services, we're sort of the whole picture of all of the things. We do focus a lot on community education, right? Just like this presentation today. We can provide different kinds of education and trainings to your community groups, to individuals, to other social service providers or nonprofits. Please just reach out to us if you're interested in that. We've done some train the trainers with RX Del Norte, in fact, for overdose prevention. So that's something that we're always happy to provide to anyone and everyone who's interested. All right, so now the big exciting stuff that everyone is here for. What is harm reduction? So this is a great quote from the harm reduction, the National Harm Reduction Coalition. We kind of like to call them our mothership of all things harm reduction. And so they define harm reduction as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. So this is really important. When we talk about harm reduction, we often frame it as little h, little r, and big H, big R. So that little h, little r, and Lasara will go into more of that little h, little r in a bit, but that's really sort of the direct services stuff, right? So harm reduction can be like a broad umbrella for services and resources for people to access. And then the big H, big R, that's the movement piece, right? That's the broader advocacy for more humane drug policies. That's the advocacy for stronger harm reduction programs, for decriminalization, for addressing the racialization of drug use and the war on drugs. The big H, big R acknowledges all of the sociopolitical aspects that impact someone's drug use and their ability to stop and start and all of those things. The big H, big R movement is really about centering the voices and experiences of people who use drugs and including them in program development and utilization. Did I miss anything there, Lasara?
No, sounds good.
Cool. Okay. So these are some sort of core practices of harm reduction. If you want to be a real good harm reductionist, you're going to want to meet people where they're at. And that's something that we practice, you know, both like in an actual physical sense by going and doing outreach into places where folks might be camping or like unhoused. And it also means meeting them where they're at. Like maybe today they don't want to talk about recovery at all. Maybe they don't want to talk about that in a month from now. Maybe they just need to come to us and say, I'm real hungry today, or I need a fresh pair of socks, or I just need some sterile syringes. So meeting that person where they're at, understanding that it's not for us to push them or direct them into something that they're not necessarily ready for, but just being open and willing to listen to what they need in that moment. And we do that as well with folks who maybe hold different beliefs than us, who may not quite understand or agree with harm reduction. We have to meet those folks where they're at as well and try to come to an understanding and say, okay, this is where you're at today with how you feel about harm reduction. Maybe the next time we talk, you'll be willing to digest a little bit more. And so harm reduction is very non-judgmental, right? Sort of related to meeting people where they're at. If that person is using drugs, we're not going to judge them for it. Of course, we want them to make the best decisions for them. We want them to be as healthy and happy as possible, but it's not on us to judge, whether they're doing that or not. Again, we're just here to provide the support, lend an ear, let someone know that they're cared about and respected as an autonomous human, and that if and when they want to move forward in their life, doing something different, making some changes, whatever that might be, we're here for them. And harm reduction certainly does not minimize the potential harms of substance use. It does understand that substance use is a reality. Human beings have been using drugs in some form or another forever and ever and ever. And oftentimes what makes a substance dangerous is the lack of education about it, the lack of access to things that can help keep you safe, like sterile equipment or Narcan, or just proper education about how to use safely. And so harm reduction really understands those parts and does not try to say, oh, well, you're doing drugs. Like, that's definitely not how we feel about it. It acknowledges a range of sociocultural factors that impact a person's use and experience, right? So we understand that race, class, gender, ethnicity, all of those things inform how a person might come to start using drugs, why they might start using drugs, and then their ability or lack thereof to stop, or the reason why they're in chaotic use compared to maybe just casual use. Those things are impacted by all of these other factors. We're going to keep coming back to that, centering folks who use drugs, centering people as experts in their own lives. We're not here to tell them how to live. We're here to ask them how they want to live and if there's any way that we can help support them to do that. It's always pragmatic and realistic, right? We can't expect someone to come in to see us for their first time and immediately be ready to get sober. Right. Even if they come to us and say, hey, this is my first time here and I want to step into recovery, we have to acknowledge the sort of pragmatic steps that need to be taken to get there. Do you have some basic primary health care? Are you housed? Do you have a phone? What sort of access to all of these other basic needs are going on before we can sort of address these bigger requests? And making baby steps, right? Letting folks know this might be a process. Don't expect to do all of the things all at once, because it can be really difficult, especially if a person is on the end of very chaotic substance use. Which, speaking of on that chaotic end, they're out of order, just kidding. We'll get to the continuum of substance use very soon. So again, these are sort of some of the broader principles that I just kind of went over. If you want sort of like a quick version, this is what you'll see as sort of the main principles of harm reduction. Again, this is courtesy of the Harm Reduction Coalition. So really focusing on health and dignity. Dignity is a huge part, right? Believing and treating folks that use drugs with dignity, believing that they are deserving of the same care and compassion and services as every other human being, because that is the truth. Participant-centered services. Again, centering that person as the expert in their lives, asking them what they need and what they might want to do, not telling them or paternalizing what you think they should be doing or need or want. Participant involvement, making sure that folks with those lived experiences are able to have leadership positions, are able to have input on what kind of services you're giving, and yeah, just all of the sort of policies and procedures around that. I went backwards. Participant autonomy, again, sort of linked with the centering folks and the dignity. People are individuals, especially if they're adults, like they can make their own choices. acknowledging those sociocultural factors, and the pragmatism and realism. And so here's that continuum of drug use, right? And really harm reduction, like I said, is a big umbrella. It gets to be used for all of these things. And oftentimes folks think that harm reduction is opposed to abstinence, and it is absolutely not the case. Harm reduction acknowledges that abstinence is on one end of the spectrum of drug use, and chaotic or persistent drug use is on that other end. And harm reduction really can be used at all points of this continuum to either help folks get to the next part that they want to be on, or keep them at the part that they want to be on if that's not a problematic place for them to be. It really just provides an array of options, right? Which everybody is different. Their experiences are unique. Their circumstances are unique. So that those differences should have services that can be specified to those needs.
All right. Am I up?
You're up.
All right. So these are some of the harm reduction services that are available at different harm reduction centers and at HACHR specifically: syringe access, syringe disposal, safer drug use. So we have kits along the lines of like snorter kits and different kits to help people, as Jessica was saying, to be safer in the area of use that they're in. Naloxone and Narcan access is essential. Medicated assisted treatment. Jessica talked about the Bright Heart program, that the low barrier Suboxone treatment. Supervised consumption sites are not something that we have in California yet, as far as I know. We definitely don't have them in Humboldt County, but they are becoming more popular across the United States, and we have hopes for that to be a reality for more people at some point. Drop-in centers, housing first, and pharmacy access. We work with pharmacy access with our consumers quite regularly. And then referrals. Referrals are something that we do a lot of. So this is just kind of to give you an overview of some harm reduction services that are available under the sort of housing of harm reduction. Next slide.
Oh yeah, I control that. I wanted to say something quick about the safer drug use. So we at HACHR have multiple kits. Lasara mentioned the safe snorting kits. Snorting or smoking drugs is more safe or has less risk than injecting. So if folks want to maybe lessen their drug use or do something that has less risk, but they're not quite ready to go full abstinence, snorting or smoking is a great option for people. The snort kits that we have really are meant to prevent the spread of Hep C and HIV. A lot of folks don't know that if you're sharing straws and you've got a broken blood vessel up in your nose and you share that with another person, you can totally contract things that way. The fentanyl test kits, right, letting people know what's in their substance so that they can determine if they're going to use that, that baggie of whatever at all, or if they're going to, be a little more cautious, they're going to start smaller, do less, go slower. Definitely make sure that they're with somebody who has Narcan, just being informed so that there's less risk. And I think that's the main sort of safer drug use kits we have. The smoker kits as well, again, as an alternative to injecting, and also so that folks can take care of their mouths and have their own supplies so that they're not having to share.
Thank you.
Mm-hmm. Oh, and all of these kits are available to anyone and everyone. A lot of folks think that if they are maybe casual drug users, or they only use a certain kind of substance, or maybe only once in a while at a party or at a bar, they're not at risk. But in today's world of fentanyl being in lots of different kinds of substances, if you use any kind of drug at any time, you could potentially be at risk. So if you know college kids or younger folks who like to party who maybe say, oh, well, I only do cocaine or Molly, like I'm fine. I would really suggest that they have these supplies, including Narcan, because if their substance that isn't an opiate is laced with fentanyl, they can overdose. Being able to test their supplies, having these things that will keep them safe from bloodborne illnesses is really important. And I sometimes think it's more important to folks who kind of treat it as more of a casual thing, because they might not always be as prepared or knowledgeable about those risks.
Agreed. All right, so here are some other forms of harm reduction, and these are things that we don't necessarily think, oh, that's harm reduction, but I'm going to help you to kind of envision this as a larger umbrella. So some other forms of harm reduction are sunscreen and seat belts and washing your hands and exercising. So I'm going to talk about washing your hands for a moment. So COVID is a thing, as we all know, and I think COVID is a really good example of a place where we can think about ways that we're using harm reduction already in our daily lives. So we know that there is a risk of transmission just by going out into the world. So the things that we might do to decrease the risk of transmission of COVID-19 are to wear a mask, wash our hands and or use hand sanitizer regularly. I have handy wipes in my car. Every time that I get into the car from going into a store or the post office or wherever I might have gone, I take my handy wipes out and I wipe my hands off real thoroughly and wipe my steering wheel down. So that's a really simple way to practice harm reduction as far as COVID goes. I'm also going to talk a little bit about our testing services for a moment. So we offer testing for HIV and hepatitis C, as Jessica was saying, and I'm the tester. So I am working on harm reduction as far as my chances of getting of transmitting or getting transmitted to regarding COVID-19. Some of the things that I'm doing to take responsibility are I'm getting tested regularly for COVID-19. I have also bought a distance thermometer so that I can take people's temperature before I do a finger poke for the blood sample for the testing. I'm going to be wearing a visor and a face mask, and the people that I'm serving will also be wearing face masks. So all of that is harm reduction. We use harm reduction every day, and I'm going to talk about that a little bit more in the next slide. Alrighty. So for example, we know that driving a car is unsafe. There are car accidents that result in injury and death on a regular basis. So, but do we stop driving? I have not stopped driving, even though I know what the risks are. So what do we do instead? We follow the speed limit. I do as much as humanly possible, almost 100%. I follow traffic laws. I wear a seat belt. I make sure that my tires are at the right pressure level. There are all kinds of harm reduction that we do around driving. Another frame to think about as far as harm reduction as a philosophy goes is the failure of abstinence-only protocols. So one of the areas that I think is a really brilliant example of where the failure of abstinence only has happened is sex education. So with abstinence-only protocols in place for sex education, STI and STD infection rates skyrocket, and unplanned pregnancies also do. Another area of abstinence-only protocols that I feel has been a huge failure is the drug war. So we end up with a bunch of people in jail and not as much money as could be going into, say, medically assisted treatment or other programs that could be helping people to voluntarily move into recovery in whatever ways that they might want to, and or programs like HACHR and other harm reduction organizations that are helping people to stay as safe as they can while engaging in whatever level of use they might be engaging in. Harm reduction as a model has been a more successful approach, and that is evidenced by dropping rates of STI and STD infection and dropping rates of unplanned pregnancy. I have found a study that was done in Colorado, and I'm sorry, I didn't look up the number, but the rate of unplanned pregnancy went down as a harm reduction approach to sexual education was taken on. Another area that we can look at as proof that the harm reduction approach works is dropping overdose rates with the provision of Narcan or naloxone. So, and we've seen this in Humboldt County. And Jessica, do you have the number on the reduction of rate of overdose deaths in Humboldt by any chance?
No, I will say that last year our rates of overdose for opiates did decrease. There's been a lot of work being done in both Humboldt and Del Norte with the RX Safe coalitions and organizations like HACHR to educate folks and get that Narcan out into the world. We are a rural area, and like many other rural areas, especially that have a large population of white folks, methamphetamine is a very severe issue along with polysubstance use. So while we have seen our opiate overdoses decrease over the last year or two, we are seeing an increase in complications and death related to methamphetamine and polysubstance use. Which is why harm reduction is super important, because for polysubstance use and methamphetamine use, there is no sort of regulated and agreed upon form of medication assisted treatment that can help folks stop methamphetamine use. And when people are polysubstance users, it makes going into programs for opiates more difficult, right? The capacity that we have in our county isn't as great as it should be for folks who are polysubstance users or primarily methamphetamine users. So we still have a lot of work to do in that regard. But yes, we are seeing declines in opiate overdose, which is still great.
Yes, thank you. So finally, harm reduction strategies and philosophy can be applied anywhere. So some of the examples that I have here are self-care, parenting, shopping, relationships, and sex. I'm going to give you a moment to think about areas where you maybe can come up with an example of harm reduction in your own life, of how you are using harm reduction principles in your own life. And if you have any questions, I know I'm kind of going through this quickly, but if you have any questions, please feel free to ask them. And also you can chat into the chat box about where some of those areas that you are doing harm reduction in your life might be, if you're willing to share that. So I'll give you a couple examples though. So self-care is, I'll use that one first. Self-care can be harm reduction in and of itself. So we might be making a choice, like for me, one of the things that I have not been super successful, so I moved to Humboldt about just under a year ago, almost a year ago exactly. And I moved up here and I didn't know the area as well. And in the place that I'd moved from, I had a trail out back my house, and I would be able to just walk out my door and go for a 2.5 mile hike with, no effort at all. And when I got up here, I stopped hiking, and my body started hurting more. I started feeling less comfortable. I started feeling more depressed. I started having more anxiety. And finally I got into therapy, and my therapist was like, so what are you doing for self-care? And I was like, I'm doing, doing this, I'm coming to therapy, I'm doing that, and I realized that I was not, walking or hiking as much as I had been, and that was a huge part of my self-care. So I started hiking again and walking again, and it was a huge immediate, I had an immediate positive response to it. Then COVID struck, and I like to hike with friends, I like to walk with friends. COVID struck, and so I was like, okay, what are my options now? I can stop walking. I can, you know, try to walk. Now, the solution that I've arrived at is that I make phone calls and I talk on the phone and I take a walk at the same time. And I'm, you know, doing socialization and I'm doing self-care and I'm walking, I'm being active and being physical in my body, which makes me feel great. And I'm doing all those things at once. So that's, for me, doing self-care is a harm reduction strategy. It keeps me healthy, it keeps me well, and it's somewhere that I can apply harm reduction every day. Parenting, one of the examples that I like to think of is when my kids were little. My kids are big now, they're 23 and 20. So when my older kiddo was little, she did not like wearing her jacket very much. And so even when it was cold out, and I remember having a conversation with a grandparent once, and they were like, the grandparent was like, "Are you gonna put the kid's jacket on before we go outside? It's cold out." And I was like, I'm gonna carry the kid's jacket and I'm gonna let the kid ask for the jacket if they want it. So that's, for me, that is recognizing the child's autonomy, recognizing that they're the expert in their experience. All of those elements that Jessica was talking about, that to me, that in parenting, deciding, choosing your battles, all of those elements, all of that is harm reduction. I'm going to take a look at the chat real quick, see if there's anything to answer. So we have a couple answers. Wearing a mask in public, going to the river on weekends during the summer for self-care, absolutely. Staying in the car with the grandkids while their mother does errands, yeah. Supporting her in parenting, wearing oven mitts when baking, absolutely. All of these are great examples. Great examples. Thank you for participating. I appreciate it. Does anybody have another example that they'd like to hear in any of those categories that I've mentioned, or we can move on to the next slide.
I really like the oven mitts and baking one.
I do too.
Because it's like common sense, right? Like you don't want to touch a hot tray, so you put on oven mitts. And really, when you think about harm reduction that way, it is sort of easier to understand and to make sense of, and to sort of see that the goal is just to make people safe, to help keep people safe and healthy, and can really be common sense.
Yes. Okay, so our model, what it is and what it isn't. So what it is low barrier and with no requirements for support. So what that means is somebody comes up to the door of HACHR, we are going to give them services, whatever they need. We aren't going to require something from them in order to get our engagement. Led by lived experience. I think Jessica's gone over that pretty thoroughly, but I'll just say lived experience is at the center of harm reduction, and that it all makes more sense when we put it in the context of lived experience. Fluid goals and process changes as barriers and or goals change. So it's a fluid process. We're meeting people where they are, as Jessica said, and we're walking with them in whatever ways that we can, as long as they want us to. And as their goals change, our strategies will change too. The goals are informed by the client, always. The goals are informed by the client. We aren't deciding for the client what the right goal is. Harm reduction and our model are informed by science and research. And it's a creative process. And I would say it's a collaborative process too. It's a co-creative process. So we're all creating the process together and coming up with creative solutions as much as possible. So what it isn't, it's not punitive. We aren't blaming anyone for anything. It's not one size fits all. It's very tailored to the specific person. It's not based on abstinence. So it is based in harm reduction and acceptance and all of those elements that Jessica was talking about earlier, and it's not static. So again, it goes back to that fluid idea of being able to move with the barriers and goals as they change. And
it's not based on abstinence, meaning like abstinence isn't the end goal for everybody, right? Some folks might come into us and that is their end goal. Like they want to work on some things, they want to get some housing, they want to see a doctor for the first time in 10 years, and eventually they just want to stop using drugs. But that's not always the case. So, you know, someone comes to us and straight up tells us, I don't ever want to stop using drugs, but I do want to feel healthier and I do want to do this more safely. We're still going to engage with that person. They don't have to tell us, well, my final goal is this. And then we say, well, that doesn't work for us. Like, we can't help you. We want to help that person get to whatever goal that they have in mind. And we're not going to kick someone out if they're, you know, if they make a goal and they don't stick to it. We obviously do have rules and boundaries. You know, we have things that people can and cannot do on the property for the safety of themselves, for the safety of others, for the sustainability of our program. So we certainly tell people no sometimes and say, hey, like that behavior is not allowed. But more than anything, we focus on behavior, right? You as a person are whole and perfect and wonderful, and you're you. There's nothing wrong with you. That behavior might not be okay. We might not want to see that behavior here, but you as a person are not wrong. So that's what we really mean when we say it's not punitive.
Definitely. All right. All right. So how you can implement harm reduction in your work. So this is a slide for you. This will be helpful for anybody. I'm going to invite you to think about the work that you do as I go through these different points. So meet your consumers and participants where they're at. So that includes physically, mentally, and emotionally, and probably other things that we didn't think of. But as Jessica was saying, physically meeting people where they are, showing up to where they are available mentally and emotionally. We let consumers take the lead in their own participation. So we disassemble barriers and purity tests. And somebody, when we did this last time, they were like, what's a purity test? So as Jessica was saying, we aren't going to make requirements of an end result of abstinence. And that is a test that is thrown down by a lot of organizations. That's just not something that we're going to do. So I'm inviting you to disassemble those barriers and purity tests. So any barriers that are in the way of your consumers and participants getting the help that they need. Combat expert advantages. So we're trained to think that we're coming into this as the expert when we're offering assistance of whatever sort. And instead, I'm going to invite you to consider the consumer as the expert in their own experience. Support harm reduction organizations. So HACHR and other harm reduction orgs in the area are working on the front lines to show up for our consumers. There's a lot of overlap between those that we serve, and we're in this together. So all of our organizations are working with a bunch of the same folks in a lot of cases. And so just keeping in mind that we're all, you know, ideally on the same team. And then finally, combat misinformation about what harm reduction is. And you can do that with your consumers and participants as well as in the community. And so, and what that might look like is just sharing some information from this slideshow even about what harm reduction is and what it means and how to implement it. Yeah, those are my thoughts on that. You want to add anything, Jessica?
There was something I was thinking about a minute ago, and then I stopped thinking about it. I guess you encourage folks to sort of think about their own work, or you know, whatever sort of thing you engage with in your life. And especially if you do, you know, if you are in some sort of social service, if you are like if you're a care provider. Heck, even if you're a grocery store clerk, right? Like think of ways that harm reduction can be relevant in your day-to-day engaging with other people, especially meeting folks where they're at, right? If you're in the service industry right now, you might get some folks who are like real angry at you because they have to wear a mask. And it might seem really hard to meet those people where they're at because you're kind of like, this is just to protect each other. So, you know, taking a breath and trying to figure out a way that you can engage with that person wherever they're at and however they're feeling, that's gonna, you know, be respectful of your boundaries and your safety, and also like try to listen to that perspective, even if you don't necessarily agree with it, as long as it's not causing you harm. And yeah, and just really doing that in the work, right? Folks who work with veterans, folks who work with survivors of domestic abuse, harm reduction, I think is really important in those spaces, and can really be useful, especially in centering the clients, and acknowledging them as the experts in their lived experience, and not necessarily treating them like they need saving, but treating them like, you know, they're coming to you, trusting you to help provide support. Not all the answers, not all the solutions, but just to be that support for somebody.
We have a couple more examples here too. So freezing a credit card in ice so you can't use it to pay off a balance, that is definitely harm reduction. Gardening for fresh greens and other veggies. Yep, for sure. Thank you all.
I like that credit card one.
Yeah. I'm also gonna, I like one of the reasons that I'm asking you all to kind of give us some examples that you use in your own life is because I feel like when we get the idea into our own frame, it's easier to really make sense of harm reduction. So I hope that as you go forward, you will be using these examples that you've come up with to kind of help you to anchor your awareness around what harm reduction is. So.
We're at the end already. I can't believe it. So this last slide is one of several photos that were taken back in 2017. So we had a class of graduate level sociology students. We do a lot of collaboration and work with the sociology department at HSU. They send us fantastic interns and volunteers every semester. Shout out Karen August. But yeah, the graduate class came to HACHR, and they provided cameras to a bunch of our consumers and said, go out into the world and take photos of things that are meaningful to you. Give us a glimpse of your life, like, you know, take photos of whatever you want people to know about you, to understand about you, right? Because a lot of times we make assumptions about people who use drugs or people who are experiencing homelessness, oftentimes just on the way that they look. So we wanted to give these folks an opportunity to say, no, this is actually who I am. This is actually what matters to me. And then the students did some focus groups and some interviews as well. And they paired up some of these really powerful quotes with some of the beautiful images that folks captured on disposable cameras. So I think this one really speaks to, you know, harm reduction and acknowledging people as people, right? Like so often we stigmatize and criticize and just treat folks like they aren't humans, like that their substance use or their homelessness or whatever sort of thing that they're dealing with is the whole of their existence, and it's not. That's just one experience that they're having, and the whole of their existence is their humanity. So I just thought this was a really beautiful quote captured by one of our consumers, and it's very simple. I'm human and I break easily, so be gentle to me. And this stuff I think can be found, oh, I don't even know where it lives anymore in the world. We had a couple art shows back in 2017. The art is hanging in our building. It's a lovely reminder all the time. And it might be on the website. And yeah, that's the end. If anyone has any questions or... I don't see Will on yet either. Did he come?
I haven't seen him pop up yet, so
Okay.
I'm the disembodied voice.
Yes, thank you for that. It was amazing. I learned new stuff today, so I really appreciate your workshop today, and the visuals were awesome as well, and I really appreciate it. So for those who are watching and we're asking about these slides, so this recording will be available on Facebook and YouTube afterwards, and they said that they can send the slides, and if you'd like to email HACHR, HACHR707@gmail.com, you can get the slides from them as well. So yeah, thank you again. And do we want to give it a few minutes to see if there's some questions that pop up?
For sure.
Sure.
Yeah, we have.
And if you want to ask a question out loud, you can raise your hand and I can turn on your volume. You'll be a disembodied voice like me, but that's okay.
And we have lots of educational brochures on like an array of things. They can all be found on our website as well. And again, any of those kits, if you know someone who uses drugs, or you just think, you know, it would be handy for you to have, please read those to you. Like I said, we have Narcan, we have different safer use kits. And yeah. Please share information with folks if you think that they might need these services.
And so folks know RX Safe Del Norte, we also have naloxone kits, and we're going to be putting a training app. We can make drop-offs, porch deliveries of Narcan, and we also now have fentanyl test kits too. So we ordered some of those. So we have some up here in Del Norte, and we've shared them with the Crescent City Police Department and Open Door Community Health, and we have more. So if you have an organization that wants to have those to be able to hand out, we have a few that we can hand out as well. So there's a question, do you work with parole officers on treatment plans at all?
We have not. That's not something that we have done. I don't know if they just don't know that as an option, or maybe that's a thing we have to work on. We have had folks come to us in the past to volunteer as part of sort of their plan to get off probation or parole. You want to speak more to that, Lasara, or?
Yeah, I mean, I think often that our frame isn't necessarily a great match for a lot of parole officers, because a lot of parole officers are looking for abstinence as an outcome, and that is not a natural fit. And so because we are not enforcers and we're not going to tell our consumers how to process their, or how to go through the process of whatever it is that they're going through. And so I think in some ways it's not a natural fit. That is not to say that we wouldn't, if a consumer were to come to us and say, is there a way you can assist me on working with my parole officer? I would absolutely do what I was capable of doing to see what I could, what could be done in that regard, if the consumer were asking for that kind of support. Our population is mostly not interested in engaging with law enforcement, and we generally don't have law enforcement on our premises as a basic guideline, because many of our consumers don't feel safe around law enforcement agents, and so that's something that is also a complicated area.
Mm-hmm. Yeah. I mean, a lot of folks do get put in jail for drug charges. And even if they end up in there and they end up sober, if they're really not ready for that step in their life, they're going to come out and they might use again. So, and that's probably going to be a violation of their probation. But again, that's their choice. And we are actually sometimes relieved when folks disappear for a while and come back and say, oh, I was just in jail. And the first thing we say is, please take some Narcan and be safe, because you've now shown up here and perhaps you're using again. And if you've been locked away and sober, people are at a heightened risk for overdose. So we definitely support folks making healthier and safer and better decisions, especially when they come out of jail. But like Lasara said, oftentimes the parole and probation is sort of like a forced thing, and that's not part of our model, the whole forcing if someone's just not ready to do that.
So Tina said you could be utilized as a support system to them, and we are absolutely willing to be part of anyone's support system. Absolutely. And all that a person needs to do is come up to the door, and we'll be available to them as part of their support system in whatever way is possible. And again, like I said, if they want us to specifically work in some way, in some capacity with their parole officer, I'm not opposed to that idea. It would just have to be initiated by the consumer. And Philip asked, law enforcement do allow people on probation to do services through HACHR for volunteering? Yeah, we've had people volunteer for their community service hours at HACHR. And right, Jessica, is that correct?
Yeah, and this happened. This was a while ago when Brandy was still the executive director. So I don't know like how like recent that has been the case. Again, if there were like a lot of people that were interested in that, we would try to work that out with law enforcement. And it was like a specific instance or two where that person came to us for their volunteer hours. And so, yeah, I'm hopeful that law enforcement would be open to that. I could see how maybe they wouldn't be. They'd be like, why are you going to go to a syringe exchange to do your volunteer hours? They might think that that's a bad, like a trigger for people, which it absolutely could be. Like if folks are indeed trying to stay abstinent and have kind of gone through recovery and are at that point, coming back to a syringe exchange can be a trigger for them, right? So if they've decided like that's something that is not in their best interest, it might not be the best fit for them. So yeah, I would say it's got to be a case by case. Hey, Will's here. Case by case basis. And we are happy to work with any and every organization if it means folks have an opportunity to improve their lives in the way that they see best. Hi, Will. I think you're muted.
Wait for Will's camera to come on.
There we go.
Yay. Howdy.
Hello.
Hi.
Hello.
Welcome.
This is Will.
Hello, Will.
He's our other incoming co-director. He's been holding down the downstairs, making sure everything gets cleaned up and put away. We're basically at the end here. Will, you want to say anything about you or about HACHR or about harm reduction?
I'm just excited to be doing this. This is something I really, really believe in, and to be a team with Lasara first and foremost, and then with the entire community is absolutely something that I can't wait to do. This is great.
Awesome.
Yay.
Thank you. I'm Malaya Florendo, trainer with RX Safe Del Norte, and thank you for joining us. It's great to just have the encouragement and to know that you're doing that work right now is awesome. So I appreciate you joining, even though you know you're busy and whatnot. We really appreciate you showing up. So thank you.
I tried to get here as fast as I could. It was just a few
No
things.
worries.
I haven't vacuumed yet, but Stacy said she'd do that.
No worries. We appreciate it. And it's, yeah, good to see people doing it and people talking about it. So it's awesome. Thank you, everyone.
So,
I have a question.
Philip also asked a question a ways back, which was, do you make drop-offs or can you be able to reach out to the Del Norte community? And we do outreach, but we have not done outreach to Del Norte. We do outreach. So we're based in Eureka. We do outreach all throughout Eureka on Wednesdays. We do outreach all throughout Eureka and Arcata, and we are looking at expanding our outreach services. So I don't know what that's going to look like. Will and I have talked about it some, but it's definitely something that we're going to need to speak with one another about and the board as well, and figure out what kind of services we can make available. And I mean, I'm definitely willing to consider the idea of some of those outreach services reaching into Del Norte if that's a possibility at some point. And if it's a need, if it were a need, then we would look at that. So if you feel like
we're authorized.
Yeah, go ahead.
Oh, sorry. Go ahead, Lasara.
No, go ahead.
I was going to say we're authorized by the state of California to provide our services, and in that authorization process, we have to specify where we go. And so Del Norte's not on that list, but our reauthorization is coming up soon. So, and I already brought it up to the person that will be engaged with to do that process, because I know we do have folks coming down from Crescent City and around in that area. So yes, I'm hoping that we can add Del Norte into our list of places and collaborate with RX Safe Del Norte, because it sounds like y'all do have some of the supplies that you can provide to your community. We're always looking for ways to reach more people if it's needed.
Yes, add us to your list.
Great. Well, we'll let the state know.
All right, I have a question, and this is one that has come up a lot in things that as we're talking and building things, but oftentimes there's people who have those in their life who are using drugs. And what are the best ways that they can build healthy boundaries and support people based on kind of your experience?
Yeah, listening and having some of those tough conversations, you know, making yourself available, but like you said, having boundaries, right? Just like we do here. It's like, if this behavior continues to happen, like, we have to take some time apart. So generally, most people in harm reduction do not believe in the tough love approach. We just believe in loving people, but acknowledge that boundaries are actually a sign of respect for the other person too. A lot of times, folks who are in chaotic substance use or unhoused or just have like a certain level of instability, no one's ever given them boundaries. That might be the reason why they're in that sort of chaotic situation. So actually, like, boundaries are a really like act of radical love, right? And respect to that person, saying, I value our relationship enough to like say no, or to say, this is what I need and this is how I feel I need to be respected. Like, can we agree to this sort of thing?
And I would also say that starting from a harm reduction frame is going to be really helpful in those relationships. Being able to really show up with a harm reduction mentality is going to be really helpful, and remembering that that's for you as well as for the other person. So being aware of your own needs and applying harm reduction there, and also not getting to the point of you know, not thinking yourself into the corner of abstinence or nothing, because that is a dead end for many relationships when we are engaging with people who are using drugs. So if someone is actively in chaotic use and you're like, it's me or your supply, you know, that's not a good setup to start from. And so for me, like, the most powerful component has been for me to be able to show up and say, these are the things that I can offer. Are any of these things that will help you? And, you know, if not, then, you know, that's you did your best. And if there are things that can help, then you've gotten off to a good start. So yeah, applying harm reduction as a model is my starting and ending point, really. Will, do you have anything to pitch in?
Yeah, I would say that you have to remember that when you are talking to someone who uses drugs, that guilt will shut them down immediately. If you guilt them in any way, the conversation will be over, whether you realize it or not. And from a user perspective, I think that's crucial.
I always tell the story or the point of my mom, and she'd be okay with me sharing this, but she was a person who used drugs, and my grandmother raised me. And literally, like, if a kid, like, asking their mom, like, please don't go, you know, like, we'd get to visit, and then I'd like go back with my grandma, like, if me like begging and pleading with her, like, please don't go, please just stay, if that can't like stop someone from using right in that moment, like, what is, right? People are just not going to be ready until they're ready. But we kept loving her, we kept supporting her, I kept seeing her, and our relationship is intact and beautiful. And now she's over 17 years sober and owns her house and has a career, and like that, right? Like, we loved her and we believed in her, and she wasn't ready until she was ready. even with someone like begging and pleading with her. But the fact that we didn't guilt her and didn't say, hey, we're cutting all ties, like I truly believe that that helped her get to that next point of just being like, shit, like I'm finally ready. And it was for her, right? Like it can't be for anybody else. It's got to be for that person. They got to be ready for them. All the other people and things can play a piece, but if it's not really, really for you, then it's not going to be successful.
Thank you for sharing. I really appreciate it. I think it's definitely something that, you know, we have to reduce that stigma and, you know, find that connection with people. And really, it's not, like you said, it's not about judging. It's not about pressure. It's all about, you know, connecting with that person and finding, you know, what will connect with them. So I really appreciate you sharing your personal stories. And yeah, we just really appreciate having you today.
We have another question too, which is there any way to get involved with HACHR, like board membership? There are so many ways to get involved with HACHR, and thank you, Glenn, for asking that question. We are always looking for folks to be involved with HACHR in a number of ways. The board is definitely one of them. We also have like volunteers are often the ones who build our kits. We have regular volunteers who pack our cottons, like all kinds of things. So if you want to be helpful to HACHR, you can definitely get in touch with us, and we will figure out a way that will work for you and that will work for us for you to support the work that HACHR does. And that may, as time goes by, we are going to be implementing ways to safely integrate volunteers into the office space. Very few at a time, because we are trying to minimize the number of people who are in the building at once. But also we can farm out volunteer opportunities as well. If you want to do the work from home, etc., we can definitely work out that relationship. So definitely get in touch with us if you're interested in helping HACHR out.
And there's a board, an application for the board on our website, HACHR707.org. Being a board member is pretty easy, just saying. It's a once-a-month board meeting, and we like the board members to engage in events, usually a couple of times a year. Everyone's frozen on my screen. I wonder if my internet is okay.
You're okay. You're okay.
Okay. Yeah. And so, yeah, really the board is just sort of a support. It's a way for the directors, whoever they may be at the time, to sort of come and brainstorm some more. But some boards have a lot of responsibilities. I like to think that HACHR's is a little bit lower, a little bit more easygoing. But if it's work that you're passionate about, I definitely recommend doing it. As I mentioned, when I leave my tenure as executive director, which is next Monday, I will be joining the board of HACHR as soon as I'm legally allowed to. So there has to be some time between being an employee and being on the board.
And that is, I really appreciate Glenn for asking these great questions. We have another one, which is there a way to donate? And the answer is yes, there are ways to donate. And depending on the size of the donation, if you want a letter of receipt on your donation, you can get in touch with us again at HACHR 707. We also have a Benivity account. So if you have a matching grant scenario with your employer through Benivity, then you can do it through Benivity. You can donate to us through our PayPal account. You can donate to us by coming up to our door and handing us money. Any number of different ways. So definitely thank you, Glenn. And I want to give a shout out to the board and just say the board is phenomenal, and it's a really great group of people. And if you're looking for an awesome way to be involved with our community in a really impactful way, then yeah, definitely think about getting on the board. Mm-hmm. Or just coming by and hanging out with us and getting to know our consumers and our people.
I would like to say too, if you have like food that you want to donate, you can do that. If you have clothing you want to donate, you can do that. Socks, underwear, those kind of things, we're always on the lookout for those. Especially socks, the thing that I desperately needed when I was out there was socks. Every day I would ask for socks. So that is something I would definitely put a big bold outline
Mhm.
Underwear too. You also mentioned underwear. I just want to put underwear too.
Yes.
Basically, we'll take all your stuff and we'll give it to the
Yes.
people who need it.
And preferably new and clean socks and underwear, I'm sure.
Yes. Yes.
Definitely.
Clothes don't have to be new, but they should be clean.
Yeah.
Awesome.
And we got a PayPal link on our website, and if you go to our Facebook, our donor box link is right pinned to the top. So lots of ways. We appreciate you all.
Yes. And I just want to say again, come on by and see the place, come meet the people, meet us, hang out, social distance with us, come and volunteer, or even if you don't have time, bring a mask. Even if you don't have time to volunteer, just come on, swing by, say hi, make yourself familiar with the place and the folks, and come get tested. We'll be starting up testing services within the month. I'm not sure exactly how far it is. We're just waiting for some supplies to come in so that we can be as safe as humanly possible. Come get tested. We have testing services available literally to anyone who wants them.
Baby boomers are on that list of people who should be tested for Hep C.
Indeed.
Awesome. Well, thank you, everyone. And we appreciate it so much, you being on today. And before we let you go, I did want to ask if you had any, last minute things you would like to put out there for everyone to hear, and any other resources you'd like to put out there as well.
I just want to say thank you all for having us today. It's been great and a really enjoyable time, and we look forward to working with you more in the future.
Definitely.
Yes.
I think the
There's
same.
also a Humboldt harm reduction.
Sorry.
You're good. The internet's unstable up here. I just wanted to mention that there is a Humboldt Harm Reduction Coalition. It's a group of community members, different social service providers, healthcare providers. We meet monthly. If that's something you'd be interested in joining, you can also email the HACHR 707 email. We've been meeting over Zoom. We're working on a media project right now called Harm Reduction is ... It's a bunch of photos of folks holding up their little blurbs about what they think harm reduction is, what harm reduction means to them, so that we can sort of reach the broader community. We put out a survey as well, and that got a lot of responses, like over 600. And so we're currently trying to plan like a sort of the people who indicated they were interested in learning more, talking more. We want to sort of share some of the data that we collected from that survey with those folks who are interested in joining, something like that. It's probably going to be in the middle of July. Again, feel free to email hatcher707@gmail.com, or you can also email the coalition directly. I'm going to put it in the chat here. It's HumboldtHRC@gmail.com. Yes, and Hannah is here from St. Joseph's, and she is a coalition member, and she's telling everyone to join.
Awesome. Will, did you want to leave us with anything? Any resources?
Sorry about that earlier. The vacuuming was happening and chaos ensued. One of the things that I'm very passionate about is writing and getting out the ideas that stick in your head, because if they're in your head, they only get bigger until they take up all of the space. So something that personally I'm very excited to be offering is notebooks to anybody that asks for them, to get it out. No one ever asked for them. We don't want them back. We don't need you to turn them in or anything, but if you want to share, we will be starting up something where that's a possibility. And again, donations for those are always welcome as well. And thank y'all for having me out. I appreciate it.
Yes, thank you all for being here today. It was awesome. Great way to kick off our summit. You're all amazing and the work you do is awesome. And I just really appreciate it. So thank you all for being on today. And again, they said the best way to contact them is HACHR707@gmail.com. That's HACHR at 707@gmail.com. And yeah, thank you for today. Before we do get off, I do want to remind everyone, oops, excuse me one moment, just to say thank you. And if you want to get involved, remember that we do have a Facebook page for this event at the Wellness and Recovery Series. You can also follow us on the RX Safe Del Norte Facebook page for more updates, and our website at www.rxsafedelnorte.org just to read more about RX Safe Del Norte. And definitely check out HACHR707.org to learn more about HACHR. And again, their email, HACHR707@gmail.com, if you'd like to get in contact with them. For everyone on today, if you would, we'd appreciate it if you could fill out your evaluation form at the end. The link is here, and we will put the link in the comments on the Facebook Live for everyone. And we have included it in the Zoom chat for now. Remember, the evaluation's pretty simple. Answer it the best you can. And if you do an eval fill out, then you will get an entry into one of our raffles for the summit this month. So yeah, again, thank you so much to HACHR for being here today. We really appreciate it. And it was a wonderful, very informative workshop. And we hope to see you again soon.
Excellent. Thank you so much.
Awesome.
Absolutely.
Thank you. Have a great day, and we'll be in touch soon on how to collaborate more across counties.
Fantastic.
All right, everyone have a good day, and thanks for joining us. Bye-bye.
Bye.